Hello, I'm Professor Emily Mercuri, and this is Chapter 11, Nutritional Concepts of Pharmacology in Essentials of Pharmacology for Health Professions, 9th edition. Chapter Objectives. Upon completion of this chapter, the learner should be able to categorize vitamins as water-soluble or fat-soluble, list vitamins and their sources, functions, signs of deficiency, and symptoms of overdose if known, describe common electrolytes and their normal blood chemistry values, identify vitamins by name and letter, list minerals and their sources, functions, and signs of deficiency, identify the chemical symbol for each mineral, describe medical conditions that may require vitamin or mineral supplements, explain the role of antioxidants in nutrition therapy, describe why and how consumers should be more vigilant in the use of herbal products. Dietary and nutrient daily requirements. The Food and Drug Administration, FDA, uses the U.S. Recommended Dietary Allowances, RDA, to develop daily values to help consumers compare the nutrient content of products. Proper dietary allowances of vitamins and minerals are necessary for the maintenance of good nutrition in an average healthy adult. Some terms to know here: adequate intake AI is based on observed or experimentally determined estimates of nutrient intake by healthy people and used when data to calculate an RDA is insufficient. So essentially this just means of the average healthy person, what is the kind of estimate of the mean amount or the normal middle of the road amount of this nutrient or mineral that they are consuming, and that's considered an adequate intake. As you can imagine, for data purposes, if there's not strong numbers that they can create an RDA, adequate intake is not considered as solid of a metric to use. Another term, tolerable upper intake level, UL, is the highest level of daily consumption that current data has shown to cause no side effects when used indefinitely without medical supervision. So essentially, the highest level of that nutrient or mineral that you should be intaking without causing significant side effects that have been observed through data or incidental case studies. Under special circumstances, vitamins and mineral supplements are required for a person's optimal function and health. The following are indications for vitamin and mineral supplements. By supplements, meaning that you're getting them in a medication form versus getting them through your diet or other external factors. So inadequate diet, due to anorexia, weight reduction, illness, alcoholism, or poor eating habits, somebody may need to supplement their diet with certain vitamins or minerals. Malabsorption syndromes, chronic gastrointestinal disorders or surgery that results in chronic diarrhea or inability to absorb certain nutrients. Some examples would be Crohn's disease, ulcerative colitis, so diseases that affect absorption of minerals and nutrients. Increased nutrients, so pregnancy and lactation, infants under the age of 1, adolescents, older adults, and postmenopausal women sometimes need increased nutrients to supplement the fluctuations in hormones and or just as the system is developing in the case of our infants and younger children. And then deficiency due to medication interaction. So some minerals can be depleted due to certain medications and how they interact in the body. So the doctor may order a supplement to take with the medication to ensure that you have enough of that mineral. Fat-soluble and water-soluble vitamins. So fat-soluble vitamins are absorbed into the bloodstream along with dietary fat, and they are stored in the liver and fatty tissue of the body. Because they're stored in the body, they can be toxic if taken in excess, and they also have the ability to stay longer in the body than the water-soluble vitamins. They are the most abundant in high-fat foods, although they can be found in other foods as well. So our examples here of fat-soluble vitamins: vitamin A, vitamin D, vitamin E, and vitamin K. And this is not a all-inclusive list, but these are the main 4 that I want you to know for this class. On the other hand, the water-soluble vitamins, These dissolve in water and are not stored in the body. They're easily lost through urine, and they need to be consumed regularly to prevent deficiencies. They can also be destroyed or washed out during food storage and preparation. And so you want to make sure that, you're getting enough of these nutrients and be mindful of how you're preparing your food. As you can imagine, water soluble, since they are more easily flushed out of the body, it's very difficult to overdose or have a toxic level of a water soluble vitamin unless you have some altered, disease process where you have kidney function issues, or you have, difficulty with elimination. For the most part, your fat soluble are the ones you need to be more worried about getting toxic levels of in the body versus the water soluble. So for the water soluble, the main two ones here are vitamin B complex and vitamin C. Knowledge check. Which is not an example of a fat soluble vitamin? A, vitamin A, B, vitamin C, vitamin D, vitamin E. The answer is B, vitamin C. So of those from the list, we're going to talk about each one a little bit more in depth. So fat-soluble vitamins, vitamin A. Here are some sources. So vitamin A can be found in the carotene of plants, dark green leafy vegetables, fruits, oily saltwater fish, dairy products, and eggs. Vitamin A is also known as retinol. Functions of vitamin A: resistance to infection, proper visual function at night, normal growth and development of bones and soft tissue, maintenance of healthy epithelial tissue, skin tissue, but epithelial tissue also lines a lot of the organs of the body, healing of wounds, and reproduction. Some signs that somebody may be deficient in vitamin A: night blindness, where vision gets much worse at night, slow growth, anorexia, where the body is very thin, not gaining weight easily. I know we think of anorexia sometimes as anorexia nervosa, which is the actual clinical, diagnosis, but anorexia in general just means weight loss. Bone and teeth deformities, dry eyes and skin, and pruritus, which is itching. Symptoms of vitamin A overdose: irritability, fatigue, headache, lethargy, which is being, weak and kind of drowsy, brittle nails, dry skin, nausea, jaundice, which is where the skin has that yellowy color to it, joint pain, stunted growth, insomnia. Vitamin D is another one of your fat-soluble vitamins. Some sources of vitamin D are sunlight on the skin, fish oils, milk, and cereals fortified with vitamin D. Functions of vitamin D: maintenance of normal nerves and muscles, regulating the absorption and metabolism of calcium and phosphorus for healthy bones and teeth, and pregnancy and lactation. Vitamin D has also been closely linked with immune system health, although it's not listed on this slide. Signs of deficiency include poor tooth and bone structure, skeletal deformities, osteoporosis, where the bone becomes less dense, osteomalacia, where the bone is more soft, it's not as hard as it should be, and then tetany, where the muscles and nerves kind of lock up. Symptoms of overdose: nausea, muscle pain, bone pain, kidney damage, kidney stone formation, heart rhythm abnormalities, hypercalcemia with convulsions or confusion, and fetal disorders. Your next fat-soluble vitamin is vitamin E. Some sources of vitamin E are cereals, wheat germ, seeds, nuts, vegetable oil, eggs, meat, and poultry. When it says cereals, a lot of times cereals are fortified with vitamins D and E, especially thinking of cereal as more, no offense if you eat cereal for breakfast every morning, but more of a food that, we would feed children. They oftentimes will fortify with certain vitamins and nutrients that children need for healthy growth and development. Functions of vitamin E: normal metabolism, protection of tissues of the eyes, skin, liver, breasts, muscles, and lungs, protecting red blood cells from damage, and decreasing platelet clumping. Signs of deficiency for vitamin E are not firmly established. However, some of the following have been indicated. Premature infants show irritability and edema, which is swelling, hemolytic anemia, and adults may show weakness and abnormal labs. Symptoms of overdose for vitamin E: bleeding in patients who are vitamin K deficient or on oral anticoagulation. So, vitamin K is also helps with the clotting of the blood. And so if someone is deficient in that and they have too much E, that can cause increased bleeding because the vitamin K is not there to help increase the clotting, and then the vitamin E is having kind of the opposite effect. And then, or on oral anticoagulation, or if they're taking blood thinners. The next fat-soluble vitamin, vitamin K. Vitamin K sources are green leafy vegetables, cabbage, vegetable oil, cheese, eggs, and liver. And the function of vitamin K is blood clotting. This is important because there are certain medications that act on the actual part of the clotting cascade that act on the part that vitamin K would work on to cause clotting. They cause that clotting to reverse. So certain medications, the medication I'm thinking of, the main one is called warfarin. If a patient's on warfarin, we want to make sure that they're not eating an abundance of vitamin K because it's going to undo that work that the warfarin's doing. So typically part of their education would be, we're not going to eat a lot of kale, a lot of these green leafy vegetables. We want to be mindful of our intake of certain foods that have a high level of vitamin K. Signs of deficiency are increased clotting time, petechiae, and bruising. Petechiae are like little red flecks that are like little burst capillaries that show up on the surface of the skin, blood in the urine or stool. Symptoms of overdose. It's rare to overdose on vitamin K. However, signs of adverse reactions can be hypersensitivity, toxicity in infants, jaundice, and hemolytic anemia. So for water-soluble vitamin sources and functions, we talked earlier about the main two water-soluble vitamins I want you to know are B complex and C. But there are a lot of different B vitamins. So when it says B complex, it's kind of including all of these. So vitamin B1, also known as thiamine. Sources of vitamin B1 are pork, beef, liver, oysters, yeast, beans, peas, collard greens, and oranges. Functions of B1 are a normal function of nervous and cardiovascular systems. It's an important nutrient that we look for when we're talking about neural tube development when a baby is in utero. So it's one that's often supplemented in prenatal vitamins. And then it's also one that we replace in patients who have any kind of liver dysfunction or chronic alcoholism, because it is such an important vitamin for all of these functions. And if your liver is not working properly, you're not going to be able to maintain good levels of vitamin B1. Signs of deficiency are GI upset, constipation, neuritis, mental disturbance, cardiovascular problems, muscle weakness, and fatigue. Symptoms of overdose, none known. Vitamin B2, also known as riboflavin. Vitamin B2 is found in milk, meat, liver, green vegetables, cereals, enriched bread, and yeast. Vitamin B2 aids in energy metabolism of glucose, fats, and amino acids. Some signs of deficiency are chylosis, which is like cracks in dried areas of the mucosa, the oral mucosa, and by the lips. Glossitis, swelling of the tongue. Photophobia, vision problems, itchy eyes, dermatitis, and rough skin. Symptoms of overdose, none. Vitamin B6. Vitamin B6 is also known as pyridoxine, but that's not a name that we're commonly going to use for vitamin B6, whereas Thiamine and riboflavin are ones that you've probably heard or you will hear more frequently. Sources of vitamin B6: pork, beef, chicken, tuna, salmon, whole grain cereals, wheat germ, legumes, peanuts, soybeans, and bananas. Vitamin B6 functions in synthesis of amino acids, antibody production, and maintenance of blood glucose level. Signs of deficiency are anorexia, nausea, vomiting, dermatitis, neuritis, and depression. Symptoms of overdose: seizures in newborns. Vitamin B12, also known as cobalamin. Sources of vitamin B12 are seafood, shellfish, meat, poultry, liver, eggs, milk, and cheese. Function is synthesis of red blood cells and maintenance of nervous system. Signs of deficiency: nerve, muscle, mental problems, and pernicious anemia. Symptoms of overdose: none. B9, also known as folic acid. Sources include organ meats, green leafy vegetables, avocados, beets, broccoli, kidney beans, and orange juice. Folic acid functions in the synthesis of red blood cells, leukocytes, DNA, and RNA needed for normal growth and reproduction. Signs of deficiency include increased risk of neural tube defects, macrocytic and megaloblastic anemia, irritability, and behavior disorders. So folic acid is one that is in prenatal vitamins that is recommended to women who are preparing to try to get pregnant who are pregnant, because it is crucial in the development of the neural tube of the fetus. Symptoms of overdose: none. Niacin, vitamin B3, found in milk, eggs, fish, poultry, legumes, nuts, and green vegetables. Functions in lipid metabolism and nerve functioning. Signs of deficiency are pellagra. And symptoms of overdose are headache, flushing, and increased blood glucose and uric acid. And what pellagra is it's a systemic disease that can impact the digestive system, cognitive function, and skin. So as you can tell, it's pretty serious if we're not getting enough of these B vitamins in our diet. And for B12 and folic acid, B9, as it talks about different types of anemia, some of those have to do with absorption, that people have chronically low anemia. Some of them have to do with the size of the blood cell itself and how it's affected by not having enough of the B vitamin. And anemia is chronically low blood count that can make someone very fatigued. As we know, red blood cells carry oxygen, so it can make someone feel short of breath. So it's crucial that we're getting enough of these B vitamins. Vitamin C. Sources of vitamin C are all citrus fruits, cantaloupe, broccoli, tomatoes, Brussels sprouts, cabbage, and green peppers. Functions are development of normal teeth, gums, and bone, prevention of scurvy, formation of collagen and healing of wounds, and absorption of iron antioxidant. Signs of deficiency are scurvy, poor healing, muscle cramps, weakness, ulcerated gums and mouth, loose teeth, and capillary fragility or bruising. Capillaries are the little tiny blood vessels that kind of branch out from the bigger blood vessels, and bruising and those capillaries bursting can be a sign of being deficient in vitamin C. Symptoms of overdose: raised uric acid level, gout, GI distress, kidney stone formation, and rebound scurvy in neonates. Knowledge check. Which water-soluble vitamin is needed for normal growth and reproduction? A, vitamin B12, B, vitamin B9, C, vitamin B1, D, vitamin C. And the answer is B, vitamin B9, also known as folic acid. Electrolytes. What are electrolytes? So electrolytes are minerals that have dissolved in body fluids and carry positive or negative electrical charges required for body activities. Common electrolytes are sodium, potassium, and chloride and can be measured through blood samples. Electrolytes assist the body in the following functions: conduction of nerve impulses, beating of the heart, skeletal muscle contraction, absorption of nutrients from the GI tract, protein synthesis, energy production, and blood formation. Electrolytes are something that will get checked in lab work frequently, especially if somebody is having certain manifestations that kind of cue the doctor into an electrolyte imbalance. Electrolytes are managed through many parts of the body, but kidney function is crucial to keeping your electrolytes balanced, especially through the RAS system, which impacts also blood pressure, heart regulation. And so the whole system is in this kind of delicate balance. So if somebody has a disorder impacting their kidneys or their blood flow, that's going to cause electrolyte issues. And if you have too much or too little of certain electrolytes, that can even cause you to have seizures. It can cause you to have cardiac abnormalities. It can even cause your heart to stop. So these are crucial. Functions and ranges of electrolytes. Sodium, chemical element capital N, lowercase a, is one of the principal minerals in the extracellular bodily fluids. Sodium has numerous body functions and assists in maintaining homeostasis. Chloride, capital C, lowercase l, is the chemical element abbreviation, is the other principal mineral in extracellular bodily fluids and assists in normal body functions. Potassium, capital K, is a mineral found in cells and assists in acid-base fluid balance and heartbeat regulation. Normal ranges should be sodium 135 to 145 milliequivalents per liter, potassium 3.5 to 5.5 millimoles per liter, chloride 96 to 106 milliequivalents per liter. Knowledge check. Which represents a normal lab value range for potassium? A, 96 to 106 millimoles per liter. B, 135 to 145 milliequivalents per liter. C, 3.5 to 5.5 millimoles per liter. D, 3.5 to 5.5 milliequivalents per liter. And the answer is C, 3.5 to 5.5 millimoles per liter. Vitamins by name and letter. So it's important to know that vitamins are known both by their vitamin, which is vitamin A, vitamin B, will always just have vitamin first. And then there's also a name for each of the vitamins and lettering nomenclature. So vitamin A, retinol, retinol, or beta-carotene. Vitamin B1 is thiamine. Vitamin B2 is riboflavin. Vitamin B3, niacin, nicotinic acid, or niacinamide. Vitamin B6, pyridoxine. Vitamin B12, cobalamin or cyanocobalamin. Vitamin C, ascorbic acid. Vitamin D2, calciferol, ergocalciferol. Vitamin D3, cholecalciferol. Vitamin E, tocopherol. Vitamin K, phytonadione. Knowledge check. Which vitamin is also known as ascorbic acid? A, vitamin A. B, vitamin B. C, vitamin C. D, vitamin D. The answer is C, vitamin C. So now let's go into mineral sources and functions. Sodium, Na. Sources of sodium are table salt, beef, eggs, milk, and cheese. Of course, many other sources as well, but those are just some primary sources. Functions of sodium in the body: maintaining fluid balance in blood and transmission of nerve impulses. Signs of deficiency: low blood pressure. Without the osmotic pressure of the sodium pulling fluid into the bloodstream, into the blood vessels, that can cause your blood pressure to be very low. Symptoms of overdose is high blood pressure. So if somebody is diagnosed with high blood pressure, we typically ask them to maintain a low sodium diet. Potassium, symbol is K. Sources of the mineral are oranges, bananas, dried fruits, and tomatoes. Functions of potassium are contraction of muscles, heartbeat regulation, transmission of nerve impulses, and maintaining fluid balance. Signs of potassium deficiency are muscle weakness, cardiac arrhythmias, so the heart is not beating in a coordinated manner, lethargy, and mental confusion, and symptoms of overdose, weakness, and cardiac arrhythmias. So it can either too little of it or too much of it cause cardiac arrhythmias. Different cardiac arrhythmias, but both can be deadly. Calcium, Ca. Sources of calcium are milk, cheese, yogurt, sardines, salmon, and green vegetables except spinach. Functions are development of bones and teeth, contraction of cardiac, smooth, and skeletal muscles, nerve conduction, and blood clotting. Signs of deficiency are osteoporosis, osteomalacia, rickets in children, muscle pathology, heart disease, and increased clotting time. Symptoms of overdose, kidney stones. So when a patient has a kidney stone, they'll ask them to actually use a strainer as they urinate to hopefully catch the stone, and it can be analyzed because they can be made up of different things. But most frequently, they're made up of calcium. That can be a symptom of overdose, is having those kidney stones form in the body. Zinc, Zn. Sources of zinc are meat, liver, oysters, poultry, fish, whole grain bread, and cereal. Zinc functions in wound healing, mineralization of bone, insulin and glucose regulation, normal taste, and antioxidants. Signs of deficiency are poor wound healing, reduced taste perception, and alcohol and glucose intolerance. Symptoms of overdose of zinc are GI distress and copper deficiency with extended use of high levels of zinc. Magnesium. Magnesium can be found in green vegetables and whole grains. Functions of magnesium are the synthesis of ATP, adenosine triphosphate, transmission of nerve impulses, and relaxation of skeletal muscles. Signs of deficiency can be imbalance and weakness. Symptoms of overdose, diarrhea. So magnesium has many therapeutic uses, including it helps to calm the nervous system. It can also help you if you have constipation to loosen your stool, and that's going to be different types of magnesium that you're going to take. So something to also know is that magnesium and potassium are friends. So no matter how much you're trying to correct a patient's potassium, if you're not giving magnesium with it, oftentimes the potassium will keep dropping. So it's just something to be aware of. Iron, Fe. Sources of iron are meat, liver, eggs, poultry, spinach, dried fruits, dried beans, and prune juice. Side note, I love how many of these can be found in liver, as if we eat liver all the time. Maybe back in the day they did, but liver is very healthy for you, but just something that cracks me up because I don't think it's something most people have in their diet. Functions of iron, hemoglobin formation. Signs of deficiency, paleness, lethargy, air hunger, and irregular heartbeat. If you don't have enough iron, you're going to be anemic. You're not going to be able to form hemoglobin, which is what binds to oxygen to carry oxygen throughout the body. Symptoms of overdose of iron, lethargy, shock, vomiting, diarrhea, erosion of the GI tract, liver, or kidney damage. Chloride, table salt. Functions of the mineral, gastric acidity, regulation of osmotic pressure, and activation of salivary amylase, which helps to break down food. Signs of deficiency, imbalance in gastric acidity and imbalance in blood pH. Symptoms of overdose, diarrhea. And then iodine, found in freshwater shellfish and seafood, and iodized salt. In America, we typically have iodized salt is a very common staple of our diet. In other countries, they do not add iodine to their salt in some other countries, and more of their citizens are deficient in it. And so that was added to table salt as a way to make sure that no one was deficient in that mineral. Functions of the mineral are it's a major component of thyroid hormones, regulating rate of metabolism, growth, reproduction, nerve and muscle function, and skin and hair growth. Signs of deficiency: goiter, which is a big swelling in the front of the throat, and hypothyroidism. Symptoms of overdose: iodine goiter, hyperactive, and enlarged goiter. And so a goiter can be caused both by a deficiency and an overdose. It can affect the thyroid function and it can cause swelling in that area. Knowledge check. Which mineral helps regulate blood glucose levels? A, zinc, B, potassium, C, sodium, D, chloride. The answer is A, zinc. Knowledge check. Which symbol represents the mineral iron? A, Cl, B, Fe, C, Ca, D, Mg. The answer is B, Fe. Medical conditions requiring vitamins or minerals. Some minerals and vitamins are administered orally or intravenously to treat various health conditions. The following are examples of how some vitamins or minerals assist in the treatment of various medical conditions. Vitamin K is utilized for bleeding disorders caused by low concentration of vitamin K-dependent blood clotting factors. Vitamin C is used as an antioxidant. And vitamin D is used for osteoporosis prevention. Knowledge check. Which vitamin is prescribed to assist in the prevention of osteoporosis? A, vitamin K, B, vitamin A, C, vitamin B, D, vitamin D. The answer is vitamin D, and oftentimes our calcium-rich products such as milk and cheese are actually fortified with vitamin D for proper absorption and for bone health. Antioxidants are another important factor in nutrition therapy. And antioxidants, what they do is they inhibit cell destruction in damaged or aging tissues caused by unstable molecules known as free radicals. The human body has developed an antioxidant system response that defends itself from free radicals. Antioxidants fight against destructive effects and function in the prevention of free radical formation by binding to and neutralizing destructive substances before they damage cells and tissues. The antioxidant vitamins include vitamin C, vitamin E, and beta-carotene, and the antioxidant minerals include copper, manganese, selenium, and zinc. Knowledge check. Which is not considered a mineral that works with antioxidant enzymes? A, magnesium, B, copper, C, manganese, and D, selenium. And the answer is A, magnesium. Vigilant use of herbal products. So herbal products have many great uses, and I'm never one to say, oh, it's all Western medicine. We shouldn't use any herbal remedies. We shouldn't, I believe that ancestors knew a lot about herbs and that they were used very effectively. But you also have to be careful when you're using them that you're getting something that is a good, like a quality product, that it is being monitored for how much of the herb is in it, that it's, it's closely monitored, that it's regulated, and that it's not going to interact with any medications that you're taking or any disease processes you may have. Herbal remedies are still popular treatment plans for many individuals. So it's important that you understand and be able to answer questions effectively and refer patients to reliable sources and information. When providing sources, be sure that the information is based on fact and not opinion. As a healthcare professional, you have a responsibility to caution your patients regarding the dangers in taking remedies that are not approved by the FDA. Again, herbal products are not well regulated the way that medications are, and especially the risk of possible interaction between natural products and prescription drugs. As a healthcare professional, it's important that you provide a warning to patients and others who may seek advice regarding the dangers of taking products that have not been adequately tested. This goes to our discussion board from last week, right? We talked about all these supplements and all of the lawsuits and things that were claimed that were not true. Consumers who decide to take advantage of the expanding market for herbal and dietary supplements should do so with care. It's imperative that they consult with their physician regarding any health conditions that could compromise their health and interact adversely. They should also be warned of the possibility of fraudulent products that lack quality control. Consumers should always read product labels, follow the directions, and heed all warnings. They should pay close attention to possible side effects, cautions, and interactions of each herbal or supplemental product and their ingredients. Knowledge check. Consumers should contact their blank before taking any herbal or supplemental medication. Hopefully we all get this. A, pharmacist. B, fitness trainer. C, physician. D, insurance company. And the answer is, of course, C, physician. It's very important that your physician has up-to-date records of not only your prescription medications, but any herbal or over-the-counter supplements you may be taking. Self-assessment. Which vitamin is used to treat bleeding disorders? What are the various ways to obtain vitamin D? What role do antioxidants play in nutritional therapy? Thank you for listening. This has been Chapter 11 of Essentials of Pharmacology for Health Professions.